gravitate to the sugary substances and ingest it in greater and greater frequency. When I see patients, especially as they enter their teen years, with multiple areas of decalcified enamel and tooth decay, the first question I ask is if they're drinking soda and how frequently. I see a very typical decay pattern with soda drinkers. Now, if resources are available to the family, many dental visits for restorations or extractions are in that patient's future. However, if the family has no access to dental care, invariably they present with a dental infection and pain that is typically minimally treated to relieve the discomfort. So, what does all this mean? It means that children, especially poor children, suffer unnecessarily because of lack of education about healthy choices, or who, once they have dental problems, do not have the access to oral health care. It means that children are unable to concentrate on schoolwork and are unable to learn. Many school days are missed due to children having dental problems that should have been prevented in the first place, affecting the child's health and costing school districts money not received when child is not in school. It means that there are heavy costs to an already overburdened system that includes hospital emergency rooms that can only provide palliative treatment, such as antibiotics and pain medication, typically at 10 times the cost of what it would cost in a dental setting. What it means is that we have a responsibility to address these issues and institute policies and programs that assure that children grow up to be healthy, to become contributing members of society. And thank you once again for the opportunity to advocate for the overall health of children and their welfare.
Thank you all. I think Senator Alquist and I do have a couple questions for this panel, beginning with a couple questions for Dr. Kaufman, author of Diabesity, a book that I read for the first time a few years ago, and I've read it a couple of times. And just given your expertise, given your experience, I think we're all in agreement that there's multiple factors for the obesity epidemic and the link between obesity and diabetes. But are there some factors, individual factors, that stand out among the rest as most significant or the most problematic areas in the area of food, beverage, nutrition?
Yes, I think drinking calories is a very common experience that children have and are not aware of the effect of the calories in there. And it does have, as Dr. Goran suggested, significant metabolic changes. So when somebody does have diabetes and they drink soda after soda, it's almost like doing the test you come to the hospital for, an oral glucose tolerance test, where you're stressing your system over and over again. And when you do that 3 or 4 times in the day, you've really significantly deteriorated your diabetes control, you've increased your obesity risk, and you've done nothing at all to obtain nutrients that you would otherwise be able to take if you were just drinking water. So in every diabetes program, in every diabetes prevention program, there's always a huge nutrition component. And first in line in all those nutrition components is to stop drinking calories.
Okay. And my reason for asking that question is, folks on both sides of the argument will say, well, there's multiple factors, and why are you just picking on this, or why are you focusing just on sweetened beverages, sugared beverages, or soda specifically? Unless there's an argument to be made from environmental factors or metabolic factors, why we should focus on sugared beverages. And if I understood your answer correctly, the answer is yes.
Yeah, I definitely am. I mean, again, drinking sugar, particularly between meals when you're just drinking it alone and there's nothing to slow its absorption down at all, is a rapid rise in the glucose value. If you happen to have diabetes already, those glucose values can go to 300, 400, which is detrimental to your overall short and long-term health.
Okay. Now, I also, in some of my reading and in some of actually the previous panel, and I think the next panel will also talk about sugar-sweetened beverages as part of a healthy diet, or at least there may be room for it in a discretionary amount of calorie allowance, et cetera. What's your thought on that?
So if you look at most of the recommended diets for somebody with diabetes, we don't recommend sugar-sweetened beverages at all. You reserve juice for when you develop a significant lowering of the blood sugar, and you need to elevate the blood sugar rapidly. But there's really no place at all for a soda, a sweetened beverage like a soda, in any diabetes diet.
And the problems emanate from, is it the portion sizes? We talked about, the small bottle to the can to the bigger sizes now more commonplace and available? Or is it the formulation of the beverage itself, or is it a combination?
Well, I think there's really three things. One is it's calories that most people are consuming that they're not aware of, and calories that are just adding extra calories. Two, it's displacing other potential nutrients. And three, it's a rapid, in liquid form, it's a more rapid elevation of the glucose value that's detrimental for somebody with diabetes.
Okay. Senator Alquist.
Thank you. First question, probably for Dr. Goran or Dr. Kaufman. We talk about the fructose in soda and how that is especially, the research shows that that's especially bad. First question would be, what do you think ought to be done about fructose in soda? If you care to answer that, that is.
I'd love to.
Well, I think the first thing that ought to be done is that we ought to know what the fructose content is of these products. The manufacturers are using high fructose corn syrup, but we guess what the proportion of glucose and fructose is in high fructose corn syrup, but we don't really know what it is. So the first thing we ought to know or disclose is how much fructose is in each drink.
And should we be putting that on the label?
I think so, yes.
Okay. Is there anything?
Yeah. I think as an endocrinologist and a diabetes physician, I think fructose has a significant role in being the worst sugar for somebody with diabetes. I think Dr. Goran explained most of the metabolic pathways, but it does end up with a significantly different metabolic pathway inside the liver.
Okay. Second question, whoever would like to answer it. Can soda ever be healthy? By that I mean the industry has been experimenting with offering soft drinks that are fortified with vitamins and other nutrients. Could you comment on to what extent these alternatives represent alternatives that are really healthier for people? On the other hand, the nutrients are helpful for the body. What do you think about all the ones, including the sugar and the caffeine and the additives?
Well,
where should we be going? What direction is the simple question?
Maybe we could probably go across the,
yes, whoever
the
would
table,
like to.
and let me just say that, to design a beverage that's going to be our way to get micronutrients. In addition, it's still got chemicals, it's still got caffeine, it's still got phosphates, it's got a lot of other things that aren't good for the body. I mean, it's just trying to balance out all of the negatives, where we would be better off taking those nutrients in a balanced diet.
Thank you. I'd like to talk about diet soda just for a moment, because I'm sure there will be those who may be speaking who will say, well, there's always diet soda. The research on adverse effects associated with sodas seems not to give as much attention to diet soda, yet we know that many people who are obese drink them, that they're often caffeinated, and that many of the artificial sweeteners have been implicated in health problems, i.e. saccharin, aspartame. How concerned should we, as consumers, and we're all consumers in this room, although I've never had a soda, we're all consumers of certain products. How concerned should we be about substituting diet sodas for sweetened sodas as a regular part of our diet?
I don't think we know enough about the